Hi folks, I'm Jeanette, your personal diabetes coach. If you are looking for a non-judgmental and non-boring diabetes coaching, then you've come to the right place. One question I get a lot in my office is, why, if I go to bed with a perfectly good blood sugar, do I sometimes wake up in the morning with a high blood sugar? I didn't do anything all night. I didn't eat anything all night. How did my blood sugar get so high? Actually, there are a couple of reasons for that, and we're going to talk about it today. If you're new here and you like what you see, make sure to subscribe and ring the little bell so you know when I upload new coaching content. Let's get started. Okay, let's talk about high blood sugar in the morning. Usually this is caused by one of two things, either dawn phenomenon or the Samoji effect. Even if you've never heard of these terms, you've probably experienced them. It's important if you wake up with a high blood sugar after going to bed with a good blood sugar that you determine which one of the two is affecting you, either dawn phenomenon or the Samoji effect. If you are going to bed with a good blood sugar and waking up with a high blood sugar, it's important to determine whether it's from dawn phenomenon or Samoji effect, because they're treated in two very different ways. Let's start with dawn phenomenon, which is the most common. Dawn phenomenon is caused from hormone fluctuations overnight. The hormones in our body are what regulate our sleep-wake cycles. One of the main hormones that does this is growth hormone. So as we get sleepy in the nighttime, our growth hormone level will start to decline and we'll feel tired. This helps us to fall asleep. Usually between about 3 to 4 o'clock in the morning, depending on your sleep cycle, that growth hormone will start to increase again to prepare you to wake up in a few hours. When growth hormone increases, it increases cortisol. Cortisol is one of the hormones in our body that tells our body to make sugar or to release sugar from our liver. The reason our body does this in preparation to wake up is so we have some energy when we wake up. People who don't have diabetes or any insulin resistance will have a regulatory effect with insulin. So when cortisol increases to increase your blood sugar, you'll have a subsequent increase in insulin to keep everything nice and balanced. If you have diabetes and your insulin regulatory system isn't really working properly, then what you have is an increase in your blood sugar without that increase in insulin to balance out your blood sugar. So the result is you wake up with a higher blood sugar. It's not because of anything that you did wrong, it's just the normal functioning of the hormones in your body. The way that you treat dawn phenomenon is typically to either treat the high blood sugar in the morning when you wake up, or if you are taking rapid-acting insulin, increase the amount of insulin that you would take before bed to counteract that increase overnight. The second thing that can cause you to wake up with a high blood sugar when you went to bed with a perfectly fine blood sugar is the Samoji effect. The Samoji effect is completely different from dawn phenomenon. What happens with Samoji effect is that you have a decrease in your blood sugar overnight. And once it gets too low, your body compensates by telling your liver to make sugar, which causes a rebound high blood sugar. We call that rebound hyperglycemia. This can happen any time of day, but when it happens overnight, we call it the Samoji effect. And that will lead you to wake up in the morning with a higher blood sugar. With the Samoji effect, the reason why you wake up with a higher blood sugar is because your blood sugar got too low overnight. The fix for this is to typically take less insulin before bed, usually long-acting insulin. You could also have a snack before bed if you don't take insulin and you just happen to have lower blood sugar overnight. The reason why it's important to determine if your high blood sugar in the morning is caused by dawn phenomenon or the Samoji effect is because they're treated completely differently. With dawn phenomenon, the problem is your blood sugar just rises overnight due to hormone fluctuations. The fix for that is to typically take more long-acting insulin before bed. Whereas the Samoji effect is a lowering of your blood glucose throughout the night to where it gets too low and you have a rebound increase in your blood sugar. The fix for that is to decrease the amount of insulin that you take before bed, your long-acting insulin. So you can see why it's important to determine which one of these you have before you start making any changes. If you have dawn phenomenon and reduce the amount of insulin that you take before bed, then it's going to get worse. If you have the Samoji effect and you increase the amount of insulin before you go to bed, it's going to make that worse and could lead to dangerous low blood sugars overnight. The next question is, how do we determine which one we have? Well, there's a couple of ways to do that. One way to check this is to use a continuous glucose monitor. A continuous glucose monitor will monitor your blood glucose every 5 minutes, even throughout the night. Then you can look at the report and see, am I just trending up overnight, or do I have a significant low before I have the increase in my blood sugar? You can do a continuous glucose monitor through your diabetes provider's office where they just put it on, you go home, you don't worry about it, you bring it back, and they can pull the report. Some people have personal continuous glucose monitors, and in that case, your diabetes provider or diabetes educator can just pull your report to determine if you've got dawn phenomenon or the Samoji effect. If you don't have access to a continuous glucose monitor, then it's a little more difficult. Not difficult, but just inconvenient. So if you do not have access to a continuous glucose monitor, you can set an alarm at some different times of night to check your blood sugar. I don't necessarily recommend waking up every hour on the hour in one night, but I do recommend setting an alarm for different times of night over, say, a week to 10 days, and then determining what your blood sugar is doing on average at different times of night. A good place to start is that 3 to 4 a.m. Because that will help you to see if you're dipping around that time of night or if you're increasing around that time of night. Definitely, if you are going to bed with a good blood sugar and waking up with a high blood sugar, it is something to mention to your diabetes provider or your diabetes educator. They can help you work through the options on how to determine exactly what's going on, and then once you determine what it is, how to fix it. It is worth it to get a little bit of data before you go to see them, so if you don't have a continuous glucose monitor, try to get a couple overnight blood glucose values to take with you. That'll just help them try to start narrowing down what's going on. So, today we answered the question, why do I wake up with a high blood sugar when I go to bed with a perfectly good blood sugar? Typically it's one of two things, dawn phenomenon or the Samoji effect. It's definitely important to know which one because they are treated completely differently. One other thing to consider if you wake up with a high blood sugar is if you're eating anything right before bed. Sometimes people will check their blood sugar and it's perfectly fine, but then they'll have a little snack before they go to bed. If that's you, I recommend cutting out that snack right before bed to see if that fixes your high blood sugar in the morning. If it doesn't, then it's time to investigate further.